You've got a representative MacDonald's group working on the community hospital. If that becomes an issue, we're hoping that's way down the food chain instead of at the top actually, but
And I have 4 people who have said they'd like to help with that.
excellent.
Is that enough, Bruce?
I still don't know, still formulating what we need
It's
to
enough
know.
for now, but you may need more.
Yeah, anybody who is interested, it would involve educating ourselves about how the several small hospitals that do exist in Maine, how they exist, what their finances are, how they're governed, how do they make it. You know, we need to set up a list of critical questions to ask people, all those sorts of things. So I can do some of it, but I really need some help.
Then there's Boothbay Regional Ambulance Service.
And I think we have representation from the ambulance service tonight, several. So one of the action items that one of the work groups that we want to put together is help the ambulance service figure out what the impact of changes in April are going to be, so that we can kind of incorporate that into our action plan. So you guys are gonna have a role in this anyway, so let us know what else we can do to help. And anybody that wants to volunteer in that effort, I know that the ambulance service relies on volunteers a lot already.
Scott, do you want to be the point person for that?
Sure, yes.
Just so we have one person to talk to.
Absolutely.
If you're not around, then Robbie.
Yeah, Robbie, they can direct it to Robbie. Absolutely.
Thank you.
Yes, sir.
Just going back to community hospital, one of the possible variations on that theme is a joint effort of community hospital and ambulance together. There are communities that do that. If I could get somebody from the ambulance service to say, you know, that I can work with them or whatever on this idea of possibly developing a joint plan for a community ambulance, community hospital together as a joint effort, that would be of interest.
I think down the road that's a good idea.
It's something to explore because we need a plan B and plan C.
The ambulance is stated Boothbay region,
Right.
and that's what it is,
Right.
Boothbay region.
And the number 3 was actually the Lincoln County healthcare component in general, absorbing all their information.
So this is people that want to work hand in hand with Lincoln County Healthcare on their transition. They put together a transition team, and we'll need some people to work together with them. And the reason why these need to be work groups is essentially the towns cannot do all of this all together. We can't work together with Lincoln County Healthcare and work out alternatives at the same time. We just don't have enough time as staff. We have staff 12, and 6 of those are people working on the road. So.
And number 4 was Lincoln County regional planning. And transportation issues if things don't go well. Mary Ellen was,
I think there's economic impact in transportation.
economic impact.
Combine those?
4 and 5.
And that's
4
what,
or 5 was economic impacts.
that's one thing that I didn't, when we were writing them down, I didn't distinguish that they were 2 different things, but I felt like they were similar. And where is Mary Ellen?
She's over here.
Okay. But I think those are things that can be jointly done, right?
Yeah.
Lincoln County. Has Lincoln County Regional Planning Commission met since the last time we met?
No,
Probably not.
we got a meeting coming up.
Okay.
Jim, can we open a window here?
Yes.
Me too.
With the air conditioner on.
I guess I have a question about the transition.
Yes.
Those actual words came out of the late July meeting that we attended at the hospital, I think, where you guys had mentioned that you were going to put together a transitional team. When you use that term, do you know, did you mean hospital staff were going to be the transitional team that we're going to work with the ambulance service and work with the community leaders to help with the transition. Were you expecting members of the public to join a group to work with hospital staff, or it's okay either way? I mean,
There's a community advisory component to the transition task force, and we saw that, although I don't think anything's set in stone, we saw that as an opportunity to have community involvement. And we haven't really started because we weren't really sure whether it would be the task force that would do it, or, so.
great, and I guess
We want to make sure there's not duplication, we're not duplicating efforts, so we're happy to work with.
And we've had several members contact us from the community that are interested in being on that transition task force. And what we've said is we're waiting to see how this pans out so that we don't duplicate those services. That's action.
So we just need to share notes then.
Yeah, maybe we can do some of that tomorrow.
Okay. Because essentially, these are all items that the town would try to take on as items of concern and change of service. These are all things that the town would do, but obviously the town cannot do this without support. It's a large change in service and the town needs some assistance.
Now, I understand Lincoln County Health having a transition team. I think the transition team is looking at a different goal than we are. Now, I don't mind working with them and having some folks work with them, transitioning to where they want to go, but that's not the ultimate goal of the community or this task force. The ultimate goal of this community is to save that ER. Now, I can understand you guys not want to duplicate what we're wanting to do, but I don't think that your transition team is going to be looking at the same things as we are. So if you're holding off on your transition team because of that,
No, we're not.
Well, there's two pieces. There's the transformation task force that we're operationally looking at everything we need to do between now and the final transition. And that group has already been set. There's work groups that are reporting to that group. For instance, I'm working with Scott on ambulance service questions and issues and data and how we're going to move forward to supporting the service. That's one of our groups as well. In fact, I'll be chatting with Scott about the other one he's going to do so that I can have some crossover with that. But so that group is underway, and what we were looking for is people to help advise through that through the community group, and that's what we were waiting to see how this was going to pan out. To add to that group or to a separate group, whatever. So maybe we can chat more about that tomorrow. How we see that working, or you see it working, and maybe it is going to be a completely different task force.
okay.
Jim, this is not a transition from the present plan to one that's more acceptable to us, but it's a transition of St. Andrews, right?
The town needs to be prepared for the next steps. If this service changes as the way Lincoln County Healthcare has proposed, there's some significant hurdles that we need to be prepared for. So I think that's what the transition team needs to be focused on, is working with Lincoln County Healthcare on that plan. And without looking at any alternative plans. So, that'll take some community members to help us with that too. I mean, I'd like to be a part of that, but honestly, I'm stretched.
so maybe we should call number 3, right, like what you have there, community advisory.
Yeah, that's
And
why I
then
wrote it in
that's
there.
the crossover. Mhm.
I think the transition team, that's what I picked up on your word, and I was just trying to get it down more, community advisory. We could add it over phrases, but
Yeah.
that's what they're gonna do.
We get the idea.
Two other things that I probably should be on there is as people have volunteered, some people are more interested in going over the raw data with us, which I didn't know those people existed, but thank you. So I would say, data analysis, we could use those people. Is that okay? I'm glad these people exist. And then, we mentioned another thing that we really didn't talk about too much, is that we're gonna need money if we're gonna continue on a course. So maybe we enlist some fundraisers.
More fundraising.
That might be a work group of itself. So all they have to worry about is trying to find donors for the project.
What was that last one, Jim?
Fundraising.
The gentleman in the.
I'm concerned that none of these address what I consider to be the fundamental underlying issue, which is who owns the hospital? And that gets back to this question of governance and the question of,
I think the four people at this table are gonna handle that one for you very nicely.
well, it seems to me it needs to be an item that gets discussed. It hasn't been discussed at all tonight. We've been proceeding as though somehow we're supposed to get together with LCH and if they change their minds, et cetera, et cetera. That leaves open the question of who owns the hospital.
Which is why I asked for the documents that had to do with the family that gave it in.
All those things are being worked on.
And honestly, this is where I see Julius's role is more important. Because he's gonna be able to dissect those documents and figure out what they legally say better than we can. So
Believe me, those are issues that we are addressing, being looked at.
and we've given Julius a tremendous amount of information to comb over, and I must have really good people that work with him, because he's encouraged us that he can get some kind of scope in about a week. So,
I'd be glad to help with that, Jim, if I could be of assistance.
absolutely. I don't
And
think
probably at a lot lower rate than.
That chance.